Professor Roberto Ferrari, thank you very much for coming here today. We are delighted to have the opportunity to invite you here as a part of the Cardio Stars program in the Cardiologist of Tomorrow branch of the ESC.
My pleasure.
The Cardio Stars program is about younger cardiologists making an interview, just casual interview about the background, the career, the thoughts from the cardio stars, like you, for instance. So could you please tell me about your background? Where did you grow up? Which city did you come from? And what kind of family did you come from?
Well, I come from a very simple family in a very small city in Italy, which is called La Spezia. And my father had a shop to sell materials. And I wanted to be an architect in my life.
Yes.
But at that time, architecture was very politically involved. And my father was a rather conservative person. And so he said, you can do either law, medicine, or engineering. And then I decided to become a lawyer.
Okay.
But when I went, and I had to go out of La Spezia, because in La Spezia there is no university. So I went to the University of Bologna, convinced to put me into the School of Law. And then I met a friend. And she said, why don't you... Actually, she was a cousin of mine, and she was a biochemist working at the University of Bologna. And she said, why don't you do medicine? And then I said, okay, I do medicine. So if you think that I always wanted to be a doctor, that is absolutely not true.
No.
Then I did medicine, and I like.
So were you a good student? Were you a good student? Were you very dedicated or
no? No. In all honesty, no. I was
Okay.
trying any trick to pass the examinations and so on. And then I met a friend who was a cardiologist, and he suggested that I should do the thesis in cardiology. So I did. In congenital heart diseases. And then I didn't see them in my life since, you know.
Okay.
So it's completely different and a bit of madness, my story. And then I decided that cardiology was a nice idea, and I entered a postgraduate school in cardiology. And I did 1 year in Italy, and then I had the opportunity to go to England. But I couldn't speak English.
Oh,
That is a big problem.
That's
I'm
kind
talking about 40 years ago, 40 or 45, even 50 years ago probably. And so when I arrived in England, they realized that I couldn't speak English, and they sent me to an English school, but also they suggested that I should work with animals because, you know, animals don't talk.
no.
And so I started to work in the laboratory, and I really enjoyed that. And at the end, I did a PhD in the metabolism of the heart. And that was an inspiration for all my career, because when I came back, I decided that close to the clinical cardiology, I should also open a laboratory for basic cardiology. I successfully did it, and it has become one of the most prestigious laboratories in Italy, has developed and so on. And so, for me, cardiology is very good because I can satisfy all my curiosity. You know, you practice cardiology, but then you ask yourself why this drug is working, what it does, and so on. And you can go to the laboratories and try to understand. That, I think, is what is good.
Yes. So who has been your most important mentor, you think? Who had the most important influence of the choices you made during your career?
A person who was a fantastic person, his name is Peter Harris. He was professor of medicine when I was in London. And he was completely different from everybody in cardiology. One of the problems is, and I warn you, is that during your career you will tend to do what other people are doing. You know, you read an article, say, oh, that is a nice idea, I should do this, and then you modify a little bit. This is a mistake. You have to have your own personality, and that is what I learned from him, and you have to have your own ideas. And I remember one day he sat like we are today. He has very good eyes like yours. He looked me into the eyes and he said, Roberto, you tell me why nature should have provided us with a response to heart failure which is beneficial. Because at that time we thought that the neuroendocrine response to heart failure was beneficial. And then I said, Prof, you always ask me this horrible question, they are very philosophical, I don't know. Then he said, that is strange, you know, it's a strange interpretation because nature never does any gift to human being. Why should do that? Must be something wrong here. And then he said, think about, because this is an important question. And then he came to Italy and he said, look, we need to find out which is the real neuroendocrine response to heart failure. Because also what we know is not necessarily the truth, because all the patients that we are studying, they have given a diuretic or a vasodilator, which influence the neuroendocrine response. He said, we should start to look at the neuroendocrine response to heart failure, severe patients untreated.
So what do you think is the most important?
No, wait.
Okay.
We couldn't found the untreated patients. We went to India. We found the patients there. We did all the research, and that research alluded to the use of beta blockers and ACE inhibitors in heart failure.
Yes.
And that was the most important piece of work which I did.
Okay.
You see, coming from a very simple question and not thinking in the same direction than everybody else. Sorry, I'm talking too long.
No, it's fine. That was just my next question. What has been the most important thing you have worked and you have achieved?
That one, and also I had the opportunity to work with another fantastic person who actually is a gold medalist of the European Society of Cardiology. He is a Pakistani working in United States. He's Shabudi Raintula. He had the idea of hibernating myocardium, and we did a lot of work on hibernation. And I think that also was quite important because it has changed the way of treating patients and as being a sort of possible alternative to transplantation. And that was really also very exciting, yeah.
Okay. So obviously you have been traveling a lot around and you have worked together with a lot of people from different parts of the world. What's the importance of that? Getting out, talking to other people instead of just staying back home in your own laboratory? Or
look, for me, this is essential, is everything. You need a fantasy. You need, you need experience. Not only in medicine, in life. You need to experience different food, see different way of living, and so on. I'm lucky. I'm lucky because I work for the university, and in Italy, if my colleague will listen to me, they will kill me. But in Italy, the only good thing of the university are the young, because they're keeping you alive, they're keeping you young and curious. Remember, curiosity is also extremely important, extremely important. And, you know, if you are curious, you like to travel because you like to see new things, new experiences. So it's important, and I would strongly suggest you to travel as much as you can.
In your opinion, what's the most important challenges for cardiology in the future? What do you believe? What does it look like?
Well,
within the next 10
all
years?
of you like to work on imaging yourself or in intervention cardiology, either hemodynamic or arrhythmology and so on. I think the future will be on prevention. I am convinced about that. And there will be few people who would like to do that. And so, you know, you should be very innovative. Future is in prevention.
Future is prevention. If you had the chance, would you have done anything differently from what you did?
Well, I did everything, in Italy we say, by the skin, without thinking too much. Perhaps a little bit more thinking, a little bit more planning would have been good. But no, I don't have a lot of regrets.
No.
I must say no.
So, what about the balance between you've been talking a bit about getting impressions from abroad and keep in mind other parts of life than cardiology. That's what I want to question you about. What's a good balance between your private life and your career? What does it?
The private life is very important. I don't like all, you know, in this modern world of globalization, somebody is very good because he can answer an email at midnight and so on. That for me is not a good sign.
No.
At all. No. Private life, for me, I'm Italian, the family is very important, and you should find a nice balance. I know that is difficult, but yes, the balance is really very important. Otherwise, you become too focused, and when you are too focused, you are obsessed about something.
What about your own free time, if you had any?
Yes, I have a lot of free time. Well, I like, I'm an enthusiastic person, so I like very much to cook. I like to walk. I did a lot of lovely walks on the Dolomites and so on. I have a house on the seaside. I like sport. I like reading. You know, almost everything. It's very difficult that I don't like something.
Okay. So, if you should pass on a very good advice for the next generation, the cardiologists of tomorrow, what would that be? What should we keep in mind?
Number one, be curious. Number two, think with your own mind and personality. Don't follow the others. Do what you think is good and be honest with yourself first and then with the patients.
Those very good points. So I think I'd like to thank you very much, Roberto Ferrari, for giving this very inspiring and interesting interview.
Inspiring,
to the
probably
young colleagues.
not, but it was nice to talk with you.
And it will be broadcasted on the ESC webpage, where we can enjoy all your interesting
all the nonsense
comments.
that I said. Okay.
Thank you so much for now.
Thank you.
It's a pleasure.